Magandang hapon pong muli, mga kababayan. I'm Daphne Osenia Paez, and we are now in the final session of today's 2024 Post-SONA Discussions. We will know more about the health and social welfare protection. As we look back, tinalakay rin ng ating Pangulong Ferdinand Marcos Jr. sa kanyang third State of the Nation address kahapon ang pagpapahalaga sa kalusugan at kapakanang panlipunan para sa seguridad ng ating mamamayan. That being said, let us now all welcome our esteemed panelists for this cluster to give us their initiatives and discuss the message of the President's State of the Nation address. We have with us Department of Social Welfare and Development Secretary Rex T. Gatchalian, Department of Health Secretary Teodoro Herbosa, Department of Human Settlements and Urban Development Secretary Jose Rizalino Acozar, and Department of Science and Technology Secretary Renato U. Solidum Jr. And at this point, we will have our panelists expound on a statement from the third State of the Nation address of the President, Ferdinand R. Marcos Jr. And one of the important topics he discussed was, here's the quote, habang ang mga modernong ospital na ito ay ginagawa pa, patuloy tayo sa pagdagdag at pagpapataas ng kalidad ng ating mga ospital at mga specialty centers. Binuksan natin sa publiko ang mahigit 20 bagong urgent care and ambulatory service or mga bukas centers sa iba't ibang lugar sa bansa. Now, please expound on this topic, Secretary Ted Herbosa.
Thank you, Daphne, and good afternoon to everyone sa aking mga kasamahan. And yes, the Bukas is a project that we started this year in January when the National Health Sector for Health met. I proposed the idea of going to the communities by building what we call urgent care and ambulatory services. And this we called the Bagong Urgent Care, and we called it Bukas for short. And this was run by our regional medical centers. This provided primary care. That means it's a first place where people will go to get health care, from consultation, primary care, to diagnostics, laboratory tests, X-ray, ultrasound, and even some levels of public health care. So it became such a hit. We were targeting 28 Bukas centers for the 28 poorest Filipinos by 2028. Would you believe, Daphne, as of July 13, we now have 27 operational. By the time the speech was made, it was only 23. Tomorrow, I'll be going to Isabela to open the 28th. So we've actually reached our target. So it looks like I've underachieved. I've overachieved. So we'll still have about 70 more that are in the pipeline. But this will be built from scratch. Most of those operational were health facilities that we had already funded but couldn't operate. And with the help of our regional medical centers, they became operational. And it became a big hit to the community. We've served over 30,000 patients since we started with the first Bukas Center in March 6th. So it's a wonderful story. In the health sector, it is a wonderful story because for years, we've actually stopped at the regional medical center and the centers for health development. This time, because the President ordered me to make the people feel healthcare, we thought of this idea to go out of the hospital into the community, and thus the Bukas was born. So basically, it partnered with another project, which was the Super Health Centers. So we have 37 of the Super Health Centers that are operational, but that's run by the local government unit. So this is our primary care, and this is the hallmark of universal health coverage.
That's great. Thank you so much, Secretary Ted. Of course, this is in keeping with the President's intention to bring healthcare closer to the people. Maraming salamat. Now, for the Department of Social Welfare and Development Secretary Rex Gatchalian, here is another excerpt from the President's State of the Nation address. The recently launched Walang Gutom 2027 will be fully rolled out for the initial 2,300 households, all the way to 300,000 food-poor households across the country by the end of the year. The program will go on until we feed the 1 million most food-poor Filipinos by 2027. An important component of our strategies to address malnutrition shall be the program for the first 1,000 days or the first 2 years of a child's life. Secretary Rex, paano nyo napapaigting ang mga strategies na ito para sa labanan ng malnutrition sa ating bansa?
Well, Daphne, thank you. First of all, this is a new program. The president, when he was running, made the bold statement that we will end hunger and fight malnutrition at the same time. You have to remember that the Sustainable Development Goal includes ending hunger. And in this day and age, while we're building an inclusive society where there's economic growth, we have to make sure we're investing in our people. And part of that investment is to once and for all end hunger in the country. So the Walang Gutom Food Stamp Program, as mentioned, is one of the key flagship programs or strategy of government in ending hunger. Here, we are giving electronic benefit cards to our poor families, the 1 million food-poor families as rated by PSA, wherein they get to go to their accredited retail shops and pick from nutritious, delicious, affordable food. We are empowering them to the right of choice. They get to choose what they want, but it's in a limited menu. And that menu came from the FNRI of DOST actually. So here kasi the whole concept is not just giving them food per se, but rather helping them create that social behavioral change. That at an early age or in their households, we teach them what is right to eat and what's good to eat and what's good for them. It's not just haphazardly giving them food, period, or giving them cash, period, but rather making sure that while we are investing in them, we're making that social behavioral change. That way, later on in life, they don't develop those sickness and the bad issues that come about with bad nutrition.
That's right, so that this change will be lasting and impactful.
Yes, and if I may say, it's the only type of its program in the country's history. There is no president who made that bold statement that once and for all will end the hunger.
Yeah, thank you, Secretary. Still on the SWD here, sa programang 4Ps naman, nabanggit ng Pangulo, with the noble aim of breaking the cycle of poverty across the country, the Pantawid Pamilyang Pilipino program has not only consistently accomplished its annual targets, but has proven its efficacy over the years. Mula noong nakaraang SONA, mahigit 420,000 pamilya na ang nakagraduate sa programa. Ibig sabihin, sa tulong ng 4Ps, mas gumanda na ang kanilang kalagayan at kakayahang makipagsapalaran sa laban ng buhay. Ano po ang masasabi nyo rito, Secretary Rex?
Well, we all know that another flagship anti-poverty program of the government is the 4Ps program. It's been around since for quite some time, since 2015. But the difference with the administration of President Marcos is his upgrading the program. A while ago, you mentioned how do we deal with the first 1,000 days. And one of the things that we are, with the instruction of the President, is to incorporate a first 1,000-day grant into the program so that pregnant and lactating women and women who have children all the way to 2 years old actually get to register themselves. For the first time, the country is going to come up with a bold initiative, working with DOH, to come up with a database for pregnant and lactating women so that we can keep track, especially of our poor pregnant and lactating women, so that we can keep track of their pre- and postnatal care. Kasi we all know that the country is still struggling with stunting. And again, the bold initiative of the President is to put a dent on that stunting number that's quite stubborn. It's been a third of our population for quite some time. So this is a very innovative initiative. In fact, the Asian Development Bank was telling us that it's one of its more aggressive types of conditional cash transfer, the first 1,000-day grant. Now, talking about the 4Ps, we're quite happy that it got center stage yesterday in the SONA. In fact, 2 exemplified 4Ps beneficiaries or coming from a 4Ps household were given acknowledgement. The engineering bar top-notcher, si Mr. Algado, Engineer Algado, and then si Kane, si Teacher Kane. Both of them come from impoverished family, one from Catil, Davao Oriental, the other one from Paway, Ilocos Norte. Comes from big families, the parents are farmers or are household help. And they showed how 4Ps, if executed the right way, can actually break intergenerational poverty. It will still take some time for us to fully appreciate the program, but there are already telltale signs that it's working. In fact, you've already mentioned 400,000 of the beneficiaries since 2015 have moved up to self-sufficiency level, so they graduated. And of that 400,000, close to around 200,000 or around 250,000 of them actually have graduates in their family. Meaning, for the first time, like si Kane and si Engineer Alegado, they were the first diploma holders in their family. So we're already breaking the intergenerational cycle of yung poverty or poverty na naisasalin from one generation to another. And of that number, around 30,000 are actually professionals. Yeah, they have they pass licensure exams. So the 4Ps program under the stewardship of President Marcos is going through an upgrading stage. We're introducing new types of grants to combat decades-old problems like stunting. 2, we're also re-engineering its automation to make sure that families get their grants faster. And 3, we're cleaning the list aggressively. Part of the Achilles heel or the weakness of the program has always been the list. So since the President took the helm, he's instructed the SWD to aggressively clean the list. And we were able to do that by deploying more case managers to look at the individual status, economic status of every family. It's noteworthy to point out that in this administration, the number of job order or yung contract of service case workers who are social workers have reduced because we've managed to turn them into contractual workers of government. So there's more incentive for them to actually do the case managing kasi there's job security in one sense.
That is remarkable. Just the extent of the design of the program is just really remarkable. Now, thank you, Secretary Gatchalian. Now, for the Department of Human Settlements and Urban Development, the President also stated during his State of the Nation address that bilang halimbawa rin dito sa Maynila, nagsimula na ang malawakang pagtutulungan upang bigyang buhay muli ang Ilog, Pasig. Please expound on this topic, Secretary Acuzar.
Magandang hapon po sa inyo lahat. Noong nakaraan po ay nagkaroon tayo ng inauguration, yung second phase po ng showcase po ng Pasig River. Ito po ay nagkaroon ng first phase at second phase para sa showcase. Ito po ay private sectors initiative. Parang wala pong government funds na ginagamit uli dito. Kasi nga po, mahirap pong kumuha ng pondo o kumuha ng budget sa government. Kaya po, yung nakaraang pong inauguration, para ipakita po kung ano ba talaga magiging itsura ng Pasig River. Kasi po yung unang groundbreaking namin, inauguration, yun po ay prominent lang. Yung pangalawang inauguration po namin, yun naman po ang meron pong commercial. Kasi po yung commercial, yun po ang gagamitin natin pang pondo para para sa construction po ng Pasig River. Kaya po ang gamit po natin dito ay private money. Sa pangkabuuan po ng pagtapos po ng Pasig River, yun po naman ang susunod namin na pag-aaralan at hanapin kasama po si First Lady. Si First Lady po ang talaga po nakatutok dito, lalo-lalo po sa Pasig River. In fact po, next week may meeting uli po kami para pag-usapan po kung paano po tatapusin ang kahabaan ng buong Pasig River. Pag-usapan po natin buong Pasig River. Ang Pasig River po, ito po ay dumuduktong ng Manila Bay at saka po ng Laguna de Bay. Ang kabuuan po nito ay mahigit pong 25 kilometro. Kabilaan po, aabutin po ng 50 kilometers po ito. At ang usapan po namin ni First Lady dito at kay Presidente Marcos po, ay tapusin natin within 3 years. Kaya po yung showcase na ito po magpapatunay na yung mga private sector, pinakita po namin, pag po kayo ay nag-develop dito, meron kayong pagkukunan ng panggastos po, doon po sa Pasig River.
Very well said, Secretary Acuzar. I was taking notes because the revitalization of the Pasig River, as we know, will benefit not just the territory around the Pasig, but the entire Metro Manila and its environs. So thank you so much for that. The President also mentioned, aside from agriculture and disaster risk, are vital sectors and pillars such as education, health, energy, low-cost housing, transport, information technology also stand to benefit from our aggressive infrastructure development as befitting our upper middle income economic target. Secretary Acosar, what could you say about this?
Now, we formulated pambansang pabahay para sa Filipino program dahil sa lumulubong housing backlog sa bansa. Dalawa po ang problema na agad nating nakita sa housing problem po. Ito po ang access to funds and affordability. Kulang po ang pondo ng gobyerno para sa pabahay. Kaya po sa 4PH private funds po ang ating tinatap para mag-construct. Para mapababa ng presyo ng bahay, humingi tayo ng interest subsidy sa gobyerno. In fact, ang pinag-uusapan po namin lagi dito para matapos po ang backlog ng housing ay yung pong private funds. Yung private fund, kamukha po nung natapos po namin na ginagawa natin 145,000 housing units. Wala pong government funds to. Kung kukwentahin po natin ito yung 145,000 at gagamit po ako ng private funds, aabutin ako ng kulang-kulang na 200 billion. Mga 170 billion. Since wala po kaming pondo sa gobyerno, naisipan po namin gumamit ng private funds. Kaya yung pera po sa bangko, yun namin tinatap. Saka pera po ng mga financial institution. Nandun lang po yun sa bangko, naka-deposit. Nakita po namin hihiramin at hana at gamitin. Kung ang hihintayin po namin yung private fund, ang government funds, wala po kami magagawa. Kaya po, sa pambansang pabahay po, ito po ang paraan namin para makabuo at matapos namin ang housing backlog.
Thank you. So kitang-kita ang investment in infrastructure and housing will have a wider economic benefit for our countrymen. Thank you, Secretary Acosar. And now, moving forward to the government's pursuit in providing nutritious food for Filipino families, I'd like to reiterate the President's statement. Closely related to these, the DOST has been continuously undertaking scientific research to develop nutritious food and drinks, which can be integrated into the government's feeding program. Secretary Solidum, what specific projects and programs do you have in line based on your ongoing research and development studies in DOST, and how will these benefit Filipino families?
Thank you for the question. First thing that the Department of Science and Technology is doing is conduct the National Nutrition Survey, which will be the basis of interventions. And the interventions are based on research and development. This is led by the Food and Nutrition Research Institute of the Department of Science and Technology, which would produce foods and drinks that would be nutritious, including the iron-fortified rice, the enhanced Nutriban with various flavor like squash, carrot, sweet potato. We also have rice mongo instant blend, pancit canton with squash, and many other ready-to-eat food. Essentially, this research would look at available commodities that can be converted into something that is nutritious for our Filipinos. What is the benefit of making this really available to everyone? In the Human Development Index of our youth, aside from education, the mental health capacity to absorb what is being taught is affected by malnutrition and stunting, by health services and social protection. So with these efforts and in collaboration with the different government agencies like DSWD and DOH, the Department of Science and Technology are providing these interventions for them to use. We also provide these interventions to the local government. For example, in the first 1,000 days, we have some formulation which can actually be produced by women, the mothers in the community, and they can actually produce it and use it for feeding. We also have a program called Community Empowerment through Science and Technology, focused on geographically isolated and disadvantaged areas. There are 5 entry points, one of which is health and nutrition, education is the next, livelihood, disaster risk reduction, and environment management. But beyond the research and development, our advocacy at the Department of Science and Technology is to empower our kababayans to create livelihood out of the things that they are able to find in their community. Because if you have money, you can buy food. So aside from providing the food that they can eat, we should also promote their livelihood.
Thank you, Secretary Solidum. And as you were speaking, we could hear the alerts going on. That's our preparedness, our government at work. Of course, we are monitoring the storm situation going on for flood risks, right? And we're in good hands here. Okay, so let's go back to the DOH. Could you please, Secretary Erbosa, could you give us an update on the 2 cancer centers that are being established by the government? The President also asked the DOH to ensure that mobile clinics are distributed to all local government units. Could you also give us an update on that?
Wonderful, Daphne, because cancer is now our number 2 killer. We're dying, our Filipinos are dying from lung cancer, breast cancer in women, cervical cancer, and colorectal cancer. And because of this, it's really timely that we develop cancer centers. So the first one inaugurated was actually they broke ground, so construction is already ongoing, is the Philippine Cancer Center. This was created by the National Cancer Act, which is a law that we passed in 2019, and eventually allowed the funding for this one. So we funded the Philippine Cancer Center. It will be a 20-story building. It will house cancer treatment, diagnosis, research, and education. But also at the same time, the University of the Philippines, Philippine General Hospital, proposed a public-private partnership model for a cancer institute. And this cancer institute will be bidded out on a PPP, again, not using government funds. So the Philippine Cancer Center will be using government funds, and the money is already with the DPWH. The construction will be building, and we will equip it all the way with a proton beam therapy, which is a very modern type of radiation therapy. The PPP model is the private sector will bid out to build the cancer center and also have excess services that will be provided for our charity patients or our social patients. So when the 2 are built, actually the university hospital, which is Philippine General Hospital, will be the training ground for our oncologists, our cancer specialists, our cancer surgeons. So that particular institute will actually supply the cancer doctors that we will be using for the Philippine Cancer Center that we will also build. But aside from this, Daphne, we've actually built several centers all over the country. We've built a total of 158 specialty centers, brain and spine, burn, cancer, cardiovascular, etc., all over the country. And 60 of these were operationalized in the time of the President. And let me go on to what was the second question, Daphne? It was about the...
Mobile clinics.
The mobile
to be
clinic, of
distributed.
course. Everybody's now asking for mobile clinics from me. We have procured through the project of the President. He funded this through the Presidential Social Fund, and we were able to procure 83 mobile clinics. The mobile clinics are actually complete with hematology, chemistry, X-ray, ultrasound, even its own generator set. So the idea of the mobile clinic is that it would go to the remote areas where doctors can't go, and it will be given to the governors so that the DOH can also help them with personnel and provide modern primary care to the remotest areas of our geographically isolated and disadvantaged area. We're planning to procure more, actually, because we have 82 provinces and another one for NCR, so that's 83. We've distributed 37. And the rest are going to, all those distributed in 37 are regions 1 to 5, including CAR. So lahat ng Luzon nabigyan na. All the provinces in Luzon have been given this in the past 2 months. And we are bringing the next batches to Visayas and Mindanao. So this is very exciting because yesterday at the SONA, many of the congressmen and governors were approaching me, how do we get one and how do we get one? So I think there'll be additional procurement. I think there's plan to procure more if this is really a successful project because, again, it's in line with what the President ordered. Bring healthcare closer to the people. So the mobile is the success of this particular idea.
Thank you, Secretary Ted. Now, back to DSWD. The President also mentioned the feeding programs in schools and child care facilities. Could you please share with us your plans to further enhance this program? And could you please tell us more about the DSWD efforts to help families who have graduated from the 4Ps?
Okay, Daphne, so we'll deal with the first part of the question first. Again, no president has ever embarked on a very aggressive anti-hunger program and a anti-stunting program. Somebody's already dealing with it seriously. For the longest time, we've known that a third of our children are stunted, and it's a number that's been prevailing in prevalence for quite some time. Under President Marcos, he's made a conscious effort to actually make sure that our nutrition programs are part and aligned with each other. That's why in last year's SONA, he referred to the Nutrition Continuity Plan. A while ago, I spoke about the food stamp program, which is outside the facilities, but it doesn't end there. Once a child gets into the daycare centers, the feeding program has already expanded. Initially, the budget for that, for the longest time, was 18 pesos or 17 pesos. But under the presidency of President Marcos, the budget has increased not only to expand its reach, but to give quality meals for children in our daycare centers or early childhood development centers. Actually, the budget now is already at 25 pesos per child, which is the largest per capita budget in history. And it has also expanded from 1.7 million beneficiaries all the way to 2 million children or kids in daycare centers. So the anti-hunger and nutrition plan of the president ranges from outside facility from 0 to 2, all the way to in-facility when you reach your daycare centers. And I understand that the DepEd side of it, the undernutrition program to combat undernutrition, which are wasted and severely wasted children, has also expanded. So the beauty with what the president is doing is it's all lined up together rather than replicating and going on top of each other. It's a continuity plan. We make sure that a child from inception all the way to grade school gets the proper nutrition, and we combat hunger and malnutrition at the same time. Now, talking about the second part of the question, what do we intend to do with 4Ps graduates? Yes, that's a very good question, and in fact, the president actually directed us to make sure that we apply a whole-of-government approach. We all know that when they graduate out of the program, they're still vulnerable. They're in that near-poor category. One shock can spiral them back into poverty. Well, within the department, we have the assistance to individuals in crisis situation. We make sure that when these families go into shock, death in a family, sickness in a family, unexpected crisis, they know that they can go to the DSWD and access our AX program. The AX program is a 35 billion peso program that serves millions of Filipinos nationwide. And it's an ongoing program. It's been streamlined, and we're embarking on an automation drive for it. But on top of that, we also have the Sustainable Livelihood Program, which will serve as crutches for families that graduate out of 4Ps. We want to make sure that the spirit of entrepreneurship is instilled in the homemakers or the breadwinners of the family. And we've also formed linkages with DOLE and TESDA about employment opportunities for the head of households or adults in the family so that they can continue their trajectory out of poverty. We've already made the investment through the 4Ps program. The president wants to make sure that they totally not only graduate out of the program, but they don't slip back to poverty. And a while ago, we spoke about first-time graduates in families. The instruction of the president is work with CHED, given that the free higher education law is already in effect, to make sure that they are given preferential treatment into higher education institutions, colleges, tech voc schools, to make sure that these families, so that we can break intergenerational poverty, we make sure that there are diploma holders in these families that graduate out of the 4Ps. So again, it's a whole of government approach. We know that DSWD can do so much, but working with DOLE, TESDA, CHED, employing that whole of government approach, we can actually make sure that not only do they graduate out of poverty, they don't slip back into poverty. The numbers that the president showed yesterday actually shows that government is working. In fact, we are back to pre-pandemic levels in terms of poverty incidents, and we are on track to hit single-digit poverty rates by 2028. So that by itself is something to show that government together, not just silos of departments, working together can actually push back against poverty.
Thank you, Secretary Rex Gatchalian. Go ahead. Thank you for that. Now for the DOST, could you please share with us the other efforts of the DOST to promote health, and if you also have programs to promote access to our geographically isolated disadvantaged areas?
Thank you for the question. Actually, DOST is also the research arm of the Department of Health when it comes to discovery of drugs from our biodiversity from plants. We also look for drugs in marine sediments. We have a big program on biomedical devices, one of which is a response to the non-availability of our medical doctors in geographically isolated and disadvantaged areas. Together with the University of the Philippines, both in Manila and Diliman, which created the RX box, which has 6 sensors that would include blood pressure, temperature, oxygen, ECG, and fetal and monitor of the pregnant woman. We can actually test the patient and have the data sent via internet, and the data can be evaluated by a specialist in our regional or specialty offices or clinics of DOH. And that, in a sense, would actually expand our health service through telehealth. And this was in particular proven during the COVID-19 pandemic, wherein we placed this in the different wards of PGH. Another big program that we are already starting is the development of a medical radionuclide facility through the Philippine Nuclear Research Institute. The goal is to produce the radionuclides for treatment of cancer, and together with the private sector and DOH, we hope to establish diagnostic centers for early detection of cancer so that we can treat patients right away. One of the problems with cancer patient is the early detection. And so with this effort, we can not only produce the radionuclides, but also the test facility and use the radionuclides for treating our patients.
Okay, thank you, Secretary Solidum. And now for DHSUD, DSUD, could you please discuss updates on DSUD's efforts to establish sustainable communities, particularly the 4PH program?
In fact, we have 45,000 development projects all over the country in different stages. And we have 200 memorandum of understanding signed by the local government. Ongoing projects are being financed by private funds. The first 4PH staging area in Pasay City. In fact, I have to explain this, the 4PH, the Pasay City. Yung Pasay City, ang isang approach namin ngayon, yung urban area. Kasi ang human settlement, not only human settlement, and urban development. So kasama sa amin urban renewal. It so happened, yung dalawang issue na yan, ay nasa department namin yung human settlement and urban development. Yung mga squatter area o slum area in ISF, isa po ang number 1 namin ngayong taon. Doon ako po kami nakatutok ngayon, ang aming department, para linisin ang mga squatter o ISF sa buong Pilipinas. In fact, nag-umpisa na po kami dyan sa Caloocan. May 4 na projects po na pang-ISF ang Caloocan. Meron na rin po kaming Pasay City. Ang isang good example para mapakita po sa lahat ng mahihirap na ito pong pambansang pabahay ay hindi po kwento. Ang hirap po kasi pag kami po sa department, pag nagkikwento po kami ng project, lagi po tinatanong sa amin, nasaan na ang resulta. Ang paggawa po ng pambansang pabahay ay vertical, hindi po kamukha nung araw, ito po ay horizontal. Pag horizontal po, in 3 to 4 months, tapos na yung projects. Makakapag-deliver ka na. Pero dito po sa buildings, hindi po pwedeng phase by phase. You have to finish all the buildings. Saka yung integrity ng building, hindi pwedeng minamadali kasi po may lindol tayo rito. Unlike yung mga horizontal structures, which is 1 story, madali lang pong gawin yan. In 3 months time, makaka-deliver ka. Kaya kami sa department, ang ginawa namin pong solution ngayon dito para mapatunayan na ang aming ahensya at ang gobyerno natin ay nakatutok sa mahihirap. In fact, kung titignan niyo po yung Pasay River, hindi po matutuloy yung Pasay River kung walang squatter relocation, yung ISF relocation. Naggawa rin po kami dyan ng, kailan po, pinirmahan po ni Presidente Marcos, yung pong proclamation na bigyan ng pabahay, proclamation yung 21 hectares dyan po sa PPA. Yung 21 hectares po yan, pag yun po binuo natin, makakabuo po tayo ng 60,000 units po dyan. Yung 60,000 units po dyan sa Pasig River at po sa mga estero, mauubos po natin lahat ng squatters along esteros and Pasig River. In fact, pag nakita niyo po, pag pumapasok na po kayo, pag nabuo na po yan, pag pumapasok na po kayo dyan sa Pasig River, makakita ko po ng full, parang township development. Yung pambansang paba, hindi lang po ito bubong. Ito po ay complete township development. Meron po itong swimming pool. Kung ano po ang nakikita nyo dyan sa BGC, nakikita nyo sa Rockwell. Kung ano po nakikita nyo, gagawin po yan ng pambansa babae. Kasi po, alam po natin, pag tumira po kayo diyan sa kondominyo, ang nakikita nyo lang po ay 4 na pader. Kailangan yung mga bata pagbaba sa grounds, nandun na po ang parks. At yung pong utos ng ating presidente, hindi po pwedeng pagbaba nila, wala silang gagawin. Saka po yung mga basic amenities like po yung health center, saka yung mga daycare, kasama po sa program ng township development ng pambansa babae. Kasi po ito, hindi na po tayo, yung mga squatters po natin, mga ISF, hindi na po sila ililipat sa labas. In city na po sila. Kasi yun po ang unang-unang billing po ng ating mahal na Pangulo, na siguraduhin na ang paglalagyan natin ng mga mahihirap ay meron silang trabaho at malapit sa kanilang pag-aaralan ng mga anak. Kaya po kami po ay in city and development. Medyo may katagalan lang po ang development kasi po vertical. Kaya makakaaso po kayo after 2 years, makikita nyo na po ang delivery ng DSUD para sa housing.
Thank you, Secretary Acosar. At this point, we will now accommodate questions from the media, starting with PTV4's Noel Talakay.
Good afternoon, everyone. My question is for Secretary Ted Herbosa. Secretary, the President also mentioned during his SONA about the dagdag yung mga gamot at saka po yung dagdag na benepisyo sa karamdaman ng acute stroke at pneumonia. Doon po sa gamot, Secretary, paano po ba ito makakatulong or doon sa mga outpatient, yung mga generic na gamot, at paano po ito magiging isang advantage para sa ating mga mahihirap? Yan lamang po. Thank you.
Thank you. Actually, ang gamot is a program ng PhilHealth na re-reimburse ang outpatient medicines. Many of our diseases, mga non-communicable diseases na may chronic medication. So, nag-umpisa sa 26 na mga gamot ang binibigay na libre sa mga miyembro sa ating mga health centers. Nag-increase na to about 50 plus, 52 yata. And this will help a lot of people kasi mahal ako. I'm taking almost 5,000 pesos a month of medication. So sa mahihirap talagang malaking amount yun. So malaking tulong yung gamot. Yung iba pang programa, siyempre, tuloy-tuloy ang pag-suporta natin doon sa packages ng PhilHealth. Yung sa stroke, yung sa dinoble yun eh. I'm just kung gusto niyo malaman yung mga amounts, malaki yung mga in-increase. For example, for all the case rates, yung mga admissions, 30% across the board, no? Teka lang ha, dito sa akin. Tapos yung sa high-risk pneumonia, minention ng President to, from the old rate of 32,000 na subsidy ng PhilHealth pag na-hospital ka, tumaas ito ng 90,000 or 182%. Yung sa acute stroke, 28,000, tumaas siya sa 76,000 or 171%. Yung dialysis, dun sa mga may kamag-anak na nagda-dialysis, first of all, in-increase yung benefit package from 144 sessions, usually by September, out of pocket ka na, yung copay. Pero in-increase ito to 156 at tinaasan pa from 2,500 to 4,000 per session. At maraming gamot doon na sinabi wala nang copay dapat at kahit private sector, dapat hindi na mag-charge ng additional except for other things na wala doon sa Table 2. Tapos may mga Z-benefit packages din na tinutuloy-tuloy yung PhilHealth, may mga sa sepsis, sa bata, neonatal sepsis, nag-increase. Ang malaking increase ay yung sa Z-benefit package for breast cancer. Dati 100,000 pag ikaw ay nagka-breast cancer, ang total cost. Inakyat na ito to 1.4 million pesos benefit for our females with breast cancer. That's 1,300%.
Oh, thank you, Secretary Ted. Okay, that's certainly good news. Next, we have Daryl Esguerra from PNA.
Good afternoon, sir. Follow-up lang po for Secretary Herbosa. Sir, aside from acute stroke and pneumonia, ano pa po yung sakit na covered nung increase sa PhilHealth benefit rates? And are these new rates are being implemented na po?
July 1, they are actually being implemented. Yung iba, yung case rate tinatawag, pare may dengue ka, in-increase ng 30%. Dati parang 5,000 lang yata ang bayad sa regular dengue. Nag-increase ito ng 30%. And then, so yung severe dengue, yung pag na-ICU ka, ganun din, nag-increase ng 30%. Across the board yon, many of the diseases na kino-cover ng PhilHealth. So, mag-expect kayo na ma-increase pa natin ang iba pang benefit packages. Kasi some of this, like for example, yung 30% case rate, 10 taon nang hindi nag-increase ang PhilHealth ng benefit packages natin. So, correctional pa lang yung 30%. With the additional increase in premiums and the savings of PhilHealth, dapat, sabi sa batas ng Universal Healthcare Law, at mapunta ito either sa decrease of benefit payments or increase in benefits. So yun ang makikita natin gagawing computations. May proseso po kasi ang pag-develop ng isang benefit package sa Benefits Committee. Tinaaral nila yung actuarial para talagang maibigay yung tamang benepisyo. At ang problema kasi kung minsan pag tinaas mo lang, tinataas din ng singil ng mga ospital, yung singil dun sa sakit na yon. So inaaral talaga that it doesn't blow away naman yung high cost sa ating mga pasyente sa ating mga ospital.
Thank you. Okay. Another question we have from J.M. Pineda, IBC 13.
Good afternoon po, sirs. Kay Secretary Herbosa po ulit, sir. Sir, tanong ko lang about dun sa super health centers and mobile clinic. Isa po kasi yan sa sinabi ni Pangulo kahapon na priority rin niya. And of course, kailan po ba ito magsisimula at paano po yun makakatulong sa mga mamamayan natin? Thank you po.
Thank you, no. So dalawa yan, yung super health center, dati nating ginagawa na yun, no. Pinondohan ito through the Health Facilities Enhancement Project. Ito ay nire-request ng mga local chief executive. So dati, health center lang, barangay health station, parang structure with a few tables. Itong super health center, dinagdagan ng birthing, laboratory, may ultrasound, yung iba may dialysis pa. So nakapagpatakbo na during the time of President Marcos, 37 additional operational units nitong super health center. Ang difference nito, ito ay run by the local government unit. Pero ang pera galing sa national government through subsidy dun sa health facilities enhancement sa yearly budget. Pero dahil may ibang LGU na 4th class, 5th class, 6th class municipalities, ang nangyari po, kami na rin na nagpapasweldo sa tinatawag naming Doctor to the Barrios na ina-assign namin sa Super Health Center. Meron din kaming nurse deployment program or public health nurses na dinideploy namin doon sa kulang ang nurses. Meron din kaming mga midwife na pinadadala din doon sa mga regions. So, para hindi na siya swelduhan noong LGU. Kasi kulang ang pondo ng mga LGU na 4th class, 5th class municipalities. Kulang talaga yung funds nila just to operate a health center. So, because of additional fund ng national government, madami na nitong napatakbo. In fact, may 200 pa na awaiting license. So, ibig sabihin nun, naghihintay din sila ng mga doktor. Nagdagdag pa nga kami ng doktor, yung tinatawag naming specialista para sa bayan. So we get our residents na nag-graduate ng specialty training sa DOH Hospital at dinideploy din namin sila doon sa mga community na yun para lang magbigay talaga ng services. Yun yung talagang idea na mapatakbo ang primary care or primary health care sa buong Pilipinas. Madami nga, dumidiretso sila sa government hospital at nakita nyo naman, pag pumunta kayo sa government hospital, pila-pila doon sa emergency room, doon sa outpatient, makakita ka mahabang pila. Ito yung reason ng pagtayo ng mga super health center kasi majority ng mga kailangan ng mamamayan natin, konting diagnostic, blood test, urine test, na pwedeng magawa sa isang super health center at ganun din sa isang bukas or urgent care center. Ang difference ng dalawa, office hours lang yung operated siya by local government, pero yung bukas, pina-operate ko ng 6 a.m. to 10 p.m. In some areas, 7 a.m. to 11 p.m. Dalawang shift ng personnel from the regional hospital. So pag may emergency ka, early morning, pumila ka na doon ng alas 6, by 7, actually in 1 hour natitreat yung mga patients. So tuwan-tuwa yung mga pasyente dito sa program na to dahil bumilis yung processing. Tapos yung mga ating mga kababayan, hindi sila yung parang nasa malaking ospital na litong-lito kung saan sila pupunta. Kasi sa dami ng tao, sa dami ng mga label na hindi nila naintindihan. Pinalinaw ko yung label, sabi ko, ang tawag dito, bakunahan, di ba? Yung animal bite center. Ito yung mga top na services na kinukuha doon sa bukas. Yung animal bite vaccination, bakuna para sa rabies. Madaming pasyenteng nagpumipila dyan. So, yung dalawang yan are complementary to each other. Sabi nila, ang strength ng universal health coverage or universal health care ay malakas at strong na primary health care services. So itong dalawa, magkatuwang ito. Yung pinatatakbo ng lokal na pamahalaan at yung pinatatakbo din ng Department of Health. And that way, nagkaka-collaborate na kami. Like for example, sa bukas, pati naggagawa silang program ng cancer screening, for example. Recently sa Pampanga, gumawa silang cervical cancer screening. So, nakikipag-usap yung aming regional hospital, mga OB-GYN, gynecologists, with the barangay health workers. At sila yung nagdadala ng pasyente na mabibigyan ng screening test. So, it's a linkage talaga of national and local government to provide better health care.
Thank you, Secretary Ted. We have an additional question here from PNA, and this is for DSUD, Secretary Acozar. Nabanggit ng Pangulo sa kanyang SONA yung tungkol sa low-cost housing na isa sa mga programa for the upper middle-income economic target. Could you please discuss this further and give us more details kung ano exactly ang programa na ito?
Itong low-cost housing, ito na po yung pambansang pabahay. Kasi po yung economic, wala na kaming yung sinasawag na socialized housing. Almost pare-pareho sa amin ang housing ngayon. Kasi po dahil doon sa pambansa pabahay. Kasi yung housing natin yun, meron tayong 1.8 million pang socialized housing na rin yan. In city. Isang good example dyan. Kamukha sinasabi natin sa Pasay. Sa Pasay po, kailan lang binigay namin ni Presidente na tinulungan po kami na makahiram ng isang area para magkaroon ng staging area. Para for the meantime, habang gagawin namin yung building, kailangan ilipat namin yung mga ISF sa staging area. Makikita po na para magkaroon pa kami ng proof of concept, binigay po sa amin yung isang area ng Manila International Airport para lagyan namin ng temporary staging area. Yung pong low-cost housing na pinag-uusapan po natin ito, ay nationwide po yan. Kabuka ngayon po, kung makikita nyo, marami na pa kaming proyekto all over the country. May Zamboanga, mayroon kang Bisaya, Ilocos, at Bicol, all over the country. Puro yan low-cost housing at socialized housing. Pag nakita nyo po yung ibang proyektong gagawin namin sa susunod na taon, kasi po yung pondong ginagamit namin ay private funds. Isang good example po, yung 145,000 units, private funds po yan. Kung gagamitin uli namin yung lumang sistema sa pag-aaral po namin, yung 145,000 units, private funds, almost 2 years namin binubuo yung programang 145,000 units, ang gamit po namin private funds. Meron kaming ginagawa ngayon at humingi kami ng solusyon para mapatapos po namin yung 1,000,000 bahay. Yung po kasing 145,000, ang gamit po namin in 2 years' time na pinag-uusapan po namin sa aming department kung paano mabubuo yung private funds na yan. Kasi wala po tayong gamit na government funds eh. So lahat ng pag-aaral po namin na gamit po namin at ang private sectors, sa aming pag-meeting, sa bangko, sa mga financer, nakakabuo po kami ng mga sistema at formula para makagawa po ng mabilis at magandang pamamahay. Yung pong nakita po namin in 2 years' time na aming pag-aaral dyan sa department, nakakita po kami ng isa pang solution para yung 145,000 na ginawa namin in 2 years at maging 1,000,000 na magawa namin in 2 years. Kasi nakakita kami isang solution kung makakita kami pribado na mabibigyan namin ng maagaan na pagpapatayo ng pabahay. Kasi po yung naging nangyari po doon sa 2 years na yan, nabuo po namin yung formula para sa interest, para doon po sa access to funds and affordability. Nabuo po yan. Ang naging problema po namin pagdating sa private sector at private developers at contractors, yung pondong pangtayo. Kasi po yung pondong pantayo ay kailangang ponduhan yung mga contractors o private developers para makatayo ng building. Eh pinag-uusapan po natin 1,000,000 hanggang 6 na milyon. Hindi po nila kakayanin. Kaya yung program po, kung para tapusin within 6 years sa pamamahala ng ating Pangulo, may hirapan po tayo kung hindi tayo gagamit ng panibagong sistema para sa financial, sa pagtayo ng building. Kaya nakaisip po kami ng ibang paraan para matulungan po yung mga contractors at developers kung paano nila mapabilis ang pagtayo. Kasi po, pag nakatayo na po, madali na pong ma-take out ng pag-ibig at ng mga bangko. Kasi po, nakakita na po tayo ng formula para doon sa affordability. Kaya siguro po, sa susunod na taon, at ikwento po namin lagi, na lahat po ngayon, in 2 years' time, makikita nyo na po lahat in Metro Manila po, sasaksihan po natin na magandang paligiran at magandang pamamahay para sa low-cost housing.
Thank you, Secretary Acuzar. And thank you so much to our members of the media for being here and for asking your questions. And now we will give time for our panelists for their final remarks, starting with Department of Social Welfare and Development Secretary Rex Gatchalian.
Daphne, thank you, and thank you for everybody who is here with us this afternoon. Rest assured that the Department of Social Welfare and Development will continue in its quest to fight hunger, to end hunger, to fight stunting, and we will continue to make sure that we enhance flagship programs, anti-poverty flagship programs like the 4Ps, to make it more in tune with the times. We understand that poverty is not one department. Poverty is not the role of one single department, but rather it's a whole of government approach. But being the lead agency in poverty alleviation, we will see to it that we introduce innovations into existing programs so that they can keep up with the demands of the times. Again, maraming salamat.
Secretary Rex Gatchalian, thank you. Up next, we have Department of Health Secretary Teodoro Herbosa.
Thank you, Daphne, and thank you everyone for listening to us. Ang Department of Health is committed to implement the universal healthcare law. That means health for all Filipinos. And by doing that, we will provide primary care. That means pag nagkasakit ka, may mapupuntahan ka at magagamot ka. So our idea is that all Filipinos will be treated, and the theme we have adopted is Department of Health Modernization for Health Equity. So it doesn't matter kung ano ka, kung mahirap ka o mayaman ka, we will have access to modern healthcare na ipinuprovide natin. Kaya hence, ito yung mga bukas centers, yung ating mobile primary care clinics na kumpleto ng equipment, at meron pa kaming programang hihintayin nyo, yung Purok Kalusugan, which is primary healthcare going from house to house, identifying yung mga malnourished na bata, yung unvaccinated na bata, yung buntis na babae, at yung matatandang may sakit na hindi nakakakuha ng gamot nila, yung mga may TB. So talagang we are going out of our hospitals and regional centers para magbigay ng kalusugan sa ating mamamayan. And we believe that these are investments of the country. The money that we use is not a cost healthcare is not a cost. Healthcare is an investment. Ito ang human capital development. We cannot be working in jobs if we're always sick. We cannot get out of poverty if we're always sick. So important yung investments natin to put money in healthcare. Third highest budget na po. I wish we were the highest para all Filipinos will not only be health na no illness but also well and live long, prosperous lives. Maraming salamat po.
Thank you, Secretary Ted Erbosa. And from the Department of Human Settlements and Urban Development, Secretary Jose Rizalino Acozar.
Kami po dito sa DSUD, sa Department of Human Settlement and Urban Development. Kayo pong walang pabahay sa bansa natin. Lalo-lalo po yung mahihirap. Sa puso po ng ating pamahalaan, kayo po nauuna. Kayo po ang mauuna sa pabahay kasi po ang aming focus ay nasa sa pabahay para sa mahihirap. At lalo po doon sa mga nasa danger area. Kayo po ay mararanasan nyo po at makikita nyo na po ang programa na ginagawa ng ating gobyerno. Doon na po sa Pasig River, kami po ay nagtatrabaho, kami ay naggagawa ng construction dyan, almost 24 hours para mapakita po na magawa po natin ang magandang kabuhayan, ang magandang kapaligiran ng Pasig River. At lalo sa pabahay, sabay-sabay po namin gagawin yan para po mabigyan ng magandang kapaligiran ang ating bansa. Maraming salamat po.
Thank you, Secretary Acozar. And from the Department of Science and Technology, Secretary Renato Solidum Jr.
Kami po sa Department of Science and Technology, katuwang ang scientific and medical communities ay nagpapatuloy po na magkaroon ng solusyon using science, technology, and innovation to address issues related to health, food and nutrition, access to clean water, clean environment, decent shelter, and clothing. At sa tingin ko po, kung tayo ay magkakaisa sa siyensya at teknolohiya at pagkakaisa, kalusugan ng bawat Pilipino ay sisigla.
Thank you, Secretary Solidum. Thank you to our honorable panelists from Health and Social Welfare Protection Cluster. And at this point, I would also like to acknowledge the presence and support of our Presidential Communications Office Secretary Cheloy Garafil. Maraming salamat, Secretary Garafil. And as this day comes to an end, I thank everyone for the participation and contributions on the first day of our 2024 Post-SONA Discussions. Today's discussion has been effective as we have seen the key priorities outlined on President Ferdinand Marcos Jr.'s State of the Nation address. And we extend the gratitude to our distinguished panelists for their comprehensive discussions and to our media representatives for their active involvement. Once again, I am Daphne Osenia Paez, and we will continue with our discussions tomorrow. Stay tuned for the 2024 Post-SONA Discussions.